So, welcome to the Community Pharmacy Mini More Profit Roundtable. I do a full hour-long Community Pharmacy More Profit Roundtable once a month. This mini version is done every Wednesday afternoon at 4:30 Eastern, 1:30 Pacific time. And we're here to help community pharmacies learn how to generate more profit and, more importantly, bypass the PBMs, the pharmacy benefit managers, in order to keep more of that profit that they make. And so my name's Breck Rice, and I have been a community pharmacy advocate for over 20 years. I love the industry. I'll do everything I can to help community pharmacies not just survive, but we want them to thrive. And so that's the reason why I do this More Profit Roundtable. I do other podcasts as well, like the PBM Reform podcast on the Pharmacy Podcast Network, to try to help make positive changes any way I can against that big PBM and insurance mafia. And it's like a little guy in a rowboat chiseling away at this big iceberg, hoping that the Titanic doesn't run into it. And we're working as hard as we can, but that progress is really slow. So wouldn't it be better if you could actually bypass the PBMs? And so that's why we do the More Profit Roundtable. And on the More Profit Roundtable, we introduce products, solutions, and services that, again, bypass the PBMs to help the community pharmacies be more profitable. I've always felt like that community pharmacies needed to have about 1/3 of their revenue from non-dispensing sources. So, as you can see by this chart here, independent pharmacies, 91% of their eggs are in that dispensing basket. You've got to diversify, you've got to expand your scope of services, do additional services that will generate new revenue and more profit for your pharmacy. And one of those ways is my own program, ServeRx. So I'm the co-founder of ServeRx. So I actually do have a day job. I don't just do podcasts. And my day job is that I co-founded a revenue cycle management company called ServeRx. Um, but ServeRx is a revenue cycle management to help community pharmacies get the fair reimbursements they deserve. And you can see by this chart right here that we're always going to pay, triple or quadruple what the PBMs will pay for the same medications when you're able to use the RBIN and PCN. So here to help you any way we can bypass the PBMs and generate more profit for your pharmacy through our program. You're probably already contracted with us because we are the preferred partner for every PSAO in the country. So if you're not enrolled or set up, let's get you set up because, like I said, you're already contracted. Now, I have outlined 3 steps for success with clinical services because every pharmacy needs this. Most pharmacies want it. The pharmacies that need it, that don't want it, will wake up soon because this really is the future of community pharmacy. And this step 1 is tremendous opportunity for community pharmacies because there's no startup costs whatsoever to do remote therapeutic monitoring. This is the first time that CMS has pushed out a program that wasn't targeted at the doctors to offer it to their patients. So now with remote therapeutic monitoring, you can actually offer this through a community pharmacy. So that's tremendous. And the first platform being offered through community pharmacies is this platform called Brain Health Plus, which we'll visit about here in just a minute. Step 2 is medical billing for clinical services through the Independent Pharmacy Provider Network. So there are more wrong ways to do medical billing than right ways, and so we wanted to identify the correct way to do this. So it is through IPPN. It's the fastest growing community health collaboration in the nation, already in like 18 or 20 states, a couple hundred pharmacies participating, several thousand physicians that are in the network. Step 3 is not for every community pharmacy because you've got to have a footprint of about a 10 by 12 square feet to build out a clinical room. But this is a unique program that if you do have the space for it, you may want to consider it. You own the clinic, but it's managed and run for you by Brim Wellness. So Brim is kind of like the Intel inside. So you own the clinic. It's your name. Brim is powering it, and they'll, like I said, they'll even staff that for you. So to start off with, let's look at the CMS CPT codes. The first one, chronic care management, or CCM. It first came out in 2015, again directed at doctors to be able to do some at-home monitoring of patients that needed chronic care services. Then in 2019, remote physiological monitoring. I always called it remote patient monitoring, RPM. In 2019, again, physicians could then have devices that help them monitor heart rate and blood sugar and different things like that, even weight, remotely. Again, focused on the doctor prescribing it to their patients. Then the new kid on the block, remote therapeutic monitoring. The first time that this doesn't focus on the provider to offer it to patients. So even a pharmacy can offer it to their senior patient population. And it's a turnkey solution that is brought to you by Remote Care Today. So Remote Care Today is going to do all the heavy lifting. There's never going to be any cost to the pharmacy to set up this program, but you'll be able to offer solutions that help your patients in a way you've never been able to help them before. So I'm pretty excited to share that program with you right now. The remote therapeutic monitoring conditions that are covered mainly are musculoskeletal disorders, but you can see there's also respiratory and medication management. In the center column here are the symptoms. It's pretty broad. Pain, stiffness, weakness. It's pretty easy to qualify a patient based on the conditions and symptoms. And then what the outcomes are, this is addressing the two top concerns that every senior has: loss of memory and loss of balance. Now, it's going to address a lot of other things like pain relief and a lot of other things for stress and other benefits too, strengthening of muscles. But it does address those main concerns and prevents falls and helps patients not lose their memory. Why is Medicare really pushing this program? It's because they're spending billions and billions of dollars every year addressing falls with seniors. Over 50 billion, and they anticipate that that's going to be over 100 billion in the next 5 years. Cognitive impairment is a significant contributor to falls, uh, and patients with dementia are 300% more likely to have a fall. So on that cognitive side, you've got about 2/3 of seniors, 70 and older, that are experiencing some kind of cognitive decline. And in fact, about every 65 seconds or just about every minute, someone is diagnosed now with Alzheimer's disease. The programs that are being presented here today, the remote therapeutic monitoring, have been clinically proven to delay or even prevent dementia by 5 to 8 years. That's tremendous. In fact, one of the other statistics not listed here is that a senior involved in remote therapeutic monitoring is 75% less likely to contract dementia. So I want to share just a 2-minute explainer video here with you about the Brain Health Plus platform for community pharmacies. This can explain how in depth and how much fun this program is for seniors better than I can.
As an independent pharmacist, you already know your patients count on you. And with reimbursement challenges and tight margins, finding new revenue streams that actually help your patients is more important than ever. That's why we're happy to introduce you to Brain Health Plus, a remote therapeutic monitoring program, RTM, covered by Medicare Part B and most Medicare Advantage plans, designed to improve memory, balance, and cognitive function in just 5 to 10 minutes a day. It does this with fun exercises and games that stimulate the brain, increasing neuroplasticity. Your patients can access Brain Health Plus from their smartphone, tablet, or computer. It's a one-of-a-kind RTM platform that offers engaging, fun, and clinically proven activities to improve cognitive health, prevent falls, and helps your senior patients stay independent longer. We're talking about daily brain games, interactive motion sensing exercises, motivational health content, medication management tools like being able to scan your medicines right into the system, reminders of when to take medicines, potential drug to drug interactions, and even geofencing alerts so loved ones are notified if a patient visits the ER or hospital. Every patient also gets a 30-second biometric facial scan they can do at home so they can scan their face and track their health as often as they wish. This amazing technology lets them track important health vitals like blood pressure, heart rate, and oxygen levels with 96% accuracy. Done with a smartphone or even a computer, it keeps patients motivated and engaged without replacing their medical care. And here's the best part, we do it all for you. You get a fully turnkey solution, flyers, posters, bag stuffers, and patient onboarding handled entirely by us. We even do all the Medicare billing. No added staff time, no upfront cost. In fact, no cost to you ever. Just real results for your patients, such as a clinically proven decrease in falls and better memory. And you can earn administrative service fees for simply reviewing monthly patient progress reports for each participating patient, which will significantly add additional profits to your bottom line. Brain Health Plus, easy for you, powerful for your patients, and great for your pharmacy. Click the book a call button to schedule a demo and bring it to your pharmacy today.
So as you can see, very comprehensive program. I love that geofencing build in that will notify a loved one if a senior ends up having to go to the emergency room. Again, very comprehensive. There's tons of tools in that platform. I've been playing around with it. I'm not quite a senior, but I've been playing around with it because it's a lot of fun. I love the brain games. I want to share one testimonial with you real quick here on the Ludafit, which is one of the tools in there. This is the kind of the Wii sports on steroids. Really a fun program. It's also the one tool in this platform that probably has the most clinical studies already done on it. And a version of Ludafit is already being used in over 500 rehabilitation centers nationwide. So a lot of documentation on the benefits. But I love this testimonial from Paul because he's 89 years old and he hates to exercise, but he'll do Ludafit.
My name is Paul Charney. I live in Tucson, Arizona. I just turned 89 years old, and I hate to exercise. When I had the opportunity to try Ludafit, I found it fun. I enjoy it. I enjoy it because it's a game, and psychologically, I know that it's benefiting me. You move, and the avatar, that is a figure that represents you on the screen, it moves along with you. And it's fun. You hear the shushing of the skis through the snow, and you see obstacles in front of you. You try to avoid the obstacles. And my very favorite, even though it's probably the most strenuous, is the Thai rock climb. What you're doing is climbing up a mountain path, and not only are you sidestepping, but along the path, there are rope ladders. And in order to climb a ladder, you reach your arms up and you just keep moving. My kids saw me exercising and they wanted to try it. And they were laughing, and it comes with a lot of giggles anyway. Initially, when I first started it, I had to hold on to a chair. But I found that repeatedly doing the exercise, I got confidence in letting go of the chair. So right now I do it freestanding. Bottom line, I'm sold on it.
I love Paul's testimonial. He talks about, avoiding the obstacles as he skis right through a boulder. But what I love about it most is that he is showing that you can reverse muscle atrophy. When he first started the program, he had to hold on to a chair, and now he can do it freestanding without any assistance. Now, remote care today, I told you it was totally turnkey. They're going to provide everything you need, including the patient education information. So posters if you want them, flyers, bag stuffers. They're actually working with a prescription bag manufacturer to do the printing right on the bag itself. They'll set you up with your own landing page, so it's like your own website for the program that you just simply direct patients to that landing page. They'll hear testimonials like Paul's and many other testimonials, and they'll get the information needed in order to take the next step and check into enrollment into the program. It's really nice to have, whoever the face of your pharmacy do a little welcome message. So if that's you, if that's one of your picks or a tech that's been with you forever that all your patients know and love, have them do it. Whoever the patients are going to recognize. Remote Care Today will help script it out for you, and it's just a little welcome message so they see a friendly face when they come to your landing page. Now, the this is so beneficial to your patients that it's going to help them in so many ways, but you also get compensated as the pharmacy. They need your help with an administrative service to go in and review the progress of the patients. This shouldn't take you more than a minute per review. So this 30-second demonstration here shows you what your responsibility is.
Working with our program is easy for you and your staff. If you choose to review your patient's monthly progress and earn administrative services fees, you will be sent a weekly email notification reminding you to log into your portal and review patient assessments. You or an appropriate member of your staff will review these reports, review the summary data for the patient, add your notes, and then simply click the sign-off box next to the record. It's that easy, and it's that fast.
So again, very quick to go in and do those reviews. In this example here on the screen on the right hand side, you'll see that with 100 patients on the program, it's the administrative service fee is $25 PMPM, so per patient per month. So it's a residual month over month. That 100 patients shouldn't take you more than 2 hours worth of time to do those reviews. So not a bad return on your time investment at $1,250 per hour. If you have multiple pharmacy locations, you can centralize that review process and have one staff pharmacist review for all of the pharmacy locations if you'd like. The patients in the onboarding will do an insurance verification. 80 to 85% won't even have a copay because they'll either be dual enrolled or they'll have a supplement plan. If the patient does have a small copay, they'll know that up front. So they won't even start the program until they know exactly what their responsibility is. Once they enrolled and go through an entire month of the platform, they have tracking that's all done. That will all then be sent to you to do the review, and you're just simply logging into a cloud-based portal to do those reviews. It's all completely HIPAA compliant, and PHI is protected in there. So an amazing program that is step one in our three-step process. I'm just going to just briefly touch on IPPN because it really takes a whole separate demo to get to all the details of the Independent Pharmacy Provider Network. But these four pillars here are the pillars for success in doing clinical services and medical billing, expanding beyond even the remote therapeutic monitoring. This is for, turning things like a flu shot into an $85 preventative health visit or, continuous glucose monitoring. Today, community pharmacies, out of the kindness of their heart, are helping patients set up their glucose monitor and the CGM here and, show them how to get their data. Well, that's really nice of you to do that, but you're not getting compensated. Under the IPPN program, you actually get compensated, and here are the CPT codes for that. Basically, it's between $50 and $150 per patient per month who's on a glucose monitor. And then you see the preventative health CPT codes here, the 99391 through 99397. and then the office visit codes are just some examples of some of the CPT codes that you will be able to do. IPPN brings a collaborating provider to you, so you don't have to figure out who's going to be your collaborating provider, and then they go recruit your local doctors to collaborate with you. Why do the doctors want to collaborate with you? Because they're missing care gaps. And when they miss those well care checkups, their quality measurement scores go down. So you can actually help improve their quality measurement scores, which then allow them to get higher reimbursements. So really, it's a win-win-win. The patient wins because they have faster, easier access to care by going to your community pharmacy, and they don't have to wait around for a month or two, to get in to see their primary care provider. Primary care providers win because they're still managing the care plan and they're getting compensated for that, plus their quality scores are going up. But the pharmacy wins the most in this scenario because, on average, the community pharmacy keeps approximately 67% of all the bill charges. So it becomes a brand new, really profitable revenue stream to your community pharmacy. The last thing I want to share with you is the brick and mortar program, BRIM. BRIM is a three-legged stool. The first leg is the managed services, so it's the helping you build out the clinic and then manage that. The second leg of the stool is the talent exchange. Some services may require a nurse practitioner. Well, they're more expensive to have on staff, so it wouldn't make sense to have one on staff if you didn't need them. So imagine the talent exchange is like Uber, but for medical staff. You post a shift, a nurse or nurse practitioner, depending on what level of service that needs to be provided, fills the shift. So that's a unique solution. And then the third leg of the stool is what I'm the most excited about. That is a financial vehicle to help community pharmacies set up their clinic, because you're going to have some build out costs and some equipment costs. But you can borrow from the pharmacy fund. And then when you pay back the pharmacy fund, which you should be able to do in 3 or 4 months with your ROI on all of your new clinical services, then you become a cooperative member of the pharmacy fund. You're not only helping the next community pharmacy set up their clinic, you're now earning interest on the money that's in that fund. Someday, hopefully, you're going to retire. You're going to hand your community pharmacy down to the next generation of pharmacists, and the fund can be part of your retirement. So I appreciate everybody taking time out of your busy schedule to meet with us this afternoon to learn about all of these clinical services. Again, I'll recap that ServeRx is here to help you get the fair reimbursements that you deserve on any of your workers' comp scripts. And then the 3 steps to success in clinical services start with remote therapeutic monitoring, absolutely no cost to the pharmacy to set up step 1. You can expand your scope of services into doing more clinical and also billing every payer, not just Medicare, with the independent pharmacy provider network, step 2. And then if you have space for it, you can do a full brick and mortar HIPAA compliant clinical room with BRIM Wellness. You can always do step 1 and never take step 2 and step 3. You can do step 1 and step 2 simultaneously. You just can't do step 3 without step 2. That is a prerequisite. You do have to have collaborating providers, and you have to be in network with the payers in order to perform services with the full brick and mortar clinic in step 3. So again, thank you so much for your attendance this afternoon, and appreciate everyone being here, taking time out of your busy schedule. My name's Breck Rice. I absolutely love community pharmacies. I'll do everything I can to help you be successful. And thank you again for joining the podcast.